amazing. I needed to be sure that we can hear you. Good morning, everyone, once again, and Happy New Year to those people that I haven't seen this year, to wish them Happy New Year personally. Thank you so much for joining this call. So, as you are already aware, today we're going to be talking about hepatitis, both hepatitis A, B, and C. We have a medical team from Ebola Rural Community Foundation with us today, and they're going to be talking to us about hepatitis. So as you are aware, hepatitis has actually been a very major issue in front burner in the medical line for a while. So we will actually give the chance to our doctors to take us through what we need to know more about hepatitis. And we are also happy to announce that the medical team will be coming to our locations to actually educate us more personally, have a physical personal interaction with us, and have us run the hepatitis test and vaccinations. So if you have any questions with regards to hepatitis as they speak, just let us know by raising up your hands, and or maybe type it in the chat box and we can reach out to them. I'm going to introduce the lead doctor, Dr. Omede Ogun. He is the lead doctor today, and he's going to introduce the remaining team members. Thank you so much once again, doctor, for coming.
Thank you so much, ma'am. Yes. Yes. Thank you so much, ma'am, for your very good introduction and for welcoming us to your very good office. We are delighted to meet with you and to do exactly what we have done for Olam Agri, and even much more by visiting the various states you have introduced to us. My name again is Dr. Omede Ogun, and I'm the technical assistant. I provide technical assistance support to Ebola Rural Community Foundation. Immediately on my left is the executive chairman of the foundation. His name is pharmacist Musa Dauda Etubi. He has his offices both in Abuja. Abuja is the headquarters, and again another office at Ikeja at the Murtala Mohammed International Airport, MM2 local wing. On my right is somebody I popularly call Iya Lagos. He's Madam Kemi, and she is really she works with Ebola Rural Foundation, Community Foundation, and provide a facilitating task by linking the foundation to various organizations. She also doubles as a very senior staff with Lagos State University Teaching Hospital. Then at the other corner that you may not see is our media expert. He's called Moses, and he's the one that have done the beautiful album We Could See. So thank you so much for welcoming us once again. Over.
Thank you so much. Thank you so much, doctor. We really appreciate your time once again. So I am going to be opening the floor for you to start with the presentation and talk. Are you ready with the presentation?
Yes, I'm ready.
Ayo, we can't hear you.
Yes, I'm ready.
Okay.
Okay, so you can share the screen. So while he's presenting, we'll be able to see him.
Okay.
I'll be sharing from my laptop, so you'll be able to see.
Okay, amazing. So those of this, you can let Ayo know when you want him to move or change the screen and all.
Okay, I will. She's just sitting right opposite. Okay, can we have it in full? Is it possible? Okay. Go to the first slide. Okay. Thank you so much, our team from the Olam HQ, and then the team from the various states of Olam, where Olam OFI operates from. This morning we are going to look very specifically at some models to create awareness and as well as educate members of us that are on the platform. This viral hepatitis training is a manual we've been able to put together for the purpose of this meeting, and it could be used across board. It has a multi-purpose effect. It could be used among healthcare providers. It's so simple enough that the language is so watered that we don't need to be even an expert to understand some of the content of what we are going to be discussing. It's also suitable for civil society organizations, NGOs, that is non-governmental organizations, both international and local. It's also suitable for village health and community health service deliveries. So this morning we are going to go through a cascade of the services that is available under our intervention, beginning from, first of all, awareness creation and education. Also including that is advocacy and courtesy call to organizations, head of agencies and organizations. We also have, following that very closely, is prevention, where we talk about primary prevention, secondary prevention, and tertiary prevention. On that prevention note is what we call testing or diagnosis, which has many ramifications, as will be seen from the presentation. And then the sequelae or the consequences of those that are affected or infected with viral hepatitis, majorly looking at viral hepatitis B and C, and by implication D, which writes as a parasite on B. Then finally we'll talk of the detailed scope of diagnosis and then possible treatment that are available. I would like to begin by giving a testimonial of one of the cases we have handled about last year. It was a case of a quantity surveyor who has been on viral hepatitis treatment for about an upward of 5 years. He contacted us through a relation, and the reason he contacted us was because he could not pay anymore. From his profiling, it was observed that what he needed was an advanced treatment for the viral hepatitis B that he was infected, and also hoping that he could be one of the 1% that has opportunity for seroconversion. What we mean by that is the drug will fight the virus to a level where the body immunity takes over. For that particular treatment, we call it pegylated interferon, and is the most expensive type of drug for viral hepatitis B. And I think at the current exchange rate, it goes for an upward of about 5 million per person for a 52-week treatment. It's like one injection for a week. That is to tell you about the devastating effect of viral hepatitis. And this is mentioned to provide a baseline of our presentation. Aya, please, next slide. Okay, this is the URCF North Central team. The reason for really putting North Central team at the forefront of the presentation is because the formation and the composition of this foundation began in Abuja, and Abuja again by chance fall within the North Central zone. But again, the foundation has staff across all of the 36 plus FCT. So there is no need for movement of staff cross movement of staff from one station or one state to another. We already have existing team across all of the states. The only team that moves along is only the principal team, which is made up of about 4 persons per time for the purpose of coordination and operations of the services that will be rendered at a particular scene or site. Next. This is our beautiful, excellent diversity management team. Immediately by the right is Mr. Ayo, who is the GM Olamagri. Very fantastic man. And he saw the need to extend this. Just by first contact of his family, he saw the great advantage of this and said, okay, this could be replicated for Olamagri. And then he requested that we bring up the proposal. And that was how we began the journey with Olam. Very excellent. And then on the extreme left is the MD of Olam, and very, very understanding man also. After going through our report, I think he posted it on your global platform, which are beautiful. It's a beautiful intervention, and if you look at the structure of the intervention, it talks about diversity and inclusiveness, which is a major component of sustainable development goal. And I could commend Olam at this point that Olam is not only meeting the need of the staff across board, across all levels, but also introducing a diversity and inclusive program into the company, and I think which support the country as in Nigeria to, meet up the sustainable development goal at the end of the strategic year of 2030. So we use this opportunity again to thank the MD and thank Mr. Ayo for providing the entry opportunity to this intervention. Next, please. Again, this is a combined summary of all the locations of over 2,000 people that were able to do with Olamagri, that cut across Apapa, Tinkan, Igomu, and the others. There are so many of them. Okay, it took us an average of about I think 2 months, 3 months. Yes, to cover all of the locations in Lagos, and we have testimonials from our website. Next. These are some of our products. In our products, we have test kits for both viral hepatitis B and C, and then we have the vaccines. We also have the consumables that go with them in their various forms. We go for best products. We started this journey about 2013, and since then till now, we have never recorded any adverse event in all of the locations and in all of the people that we have covered. So we go for best product, highest quality of healthcare provision. Next, please. Again, URCF is affiliated to 2 major labs in Lagos alone. One is the Portal Services Lab, which is demonstrated here, and the other is L Lab, which have location in about 10 positions across Lagos State. So we are linked to very good expertise, and our services is top-notch. Next, please. Again, Philips Pharmaceutical is an Indian company, and from inception, since 2013, they have been the sole provision of all the materials we use. Because the reason we don't just go to the open market to get our product is because of the consequences we have observed with other intervention. So since we began the patronage with them, and they have become a very good subsidiary in our services, we have stick to them, and we'll be working together as a consortium to deliver best top-notch services to our client. This is a copy of the final report of Olam being presented to the MD of Philips Pharmaceutical for their laudable support in the course of the project. In the case of Olam OFI too, all of the products we'll be using will be coming from Philips Pharmaceutical. Next. Yes. In 2013, the Federal Ministry of Health did a population-based study of the existence of viral hepatitis B and C among Nigerians. Hello? Are you hearing me, please? Yes. Okay, when that was done, the average prevalence of viral hepatitis B was placed at 11% of the entire population of Nigeria. If you calculate the estimated population of Nigeria today to be about 230 million people, just do 11% of it, you will know how many people carry the virus. The most unfortunate thing is that viral hepatitis B and C are called silent killers. Most people get diagnosed when they go for other conditions. As simple as malaria is, they say, oh, you were tested for malaria, you have been on 3 days treatment, and yet you are not getting better. Because most of the symptoms and signs that come with viral hepatitis look more or less like that of malaria. And so most times is the tendency to ask for it is not there. You say, is it not just malaria? And for some people, after treatment for malaria, there's a receding of the virus. And then, even while the virus may be in, the symptoms don't come up anymore until after about 15 to 18 years. And at that time, when it comes up, it comes with complication. Most times in the medical parlance, we say, once you notice one complication with viral hepatitis, all you need to do is give the patient 16 weeks. Because the hepatitis must have caused a lot of damage in the person for the complication to manifest. So, in this awareness creation and education of your team, we are going to specifically look at the basic knowledge for the continuum of hepatitis prevention, screening or testing, treatment, and support, care support. Next please, yes. Module 1 is looking at the overview of viral hepatitis infection. Go on, go on. Go on. Okay, go on again, enter again. Good. Now, what is hepatitis? In layman terms, we just say it's an inflammation of the liver. And what causes the inflammation? When there is a foreign body in form of the viral hepatitis that gets to the liver, the target of the virus is the liver, most importantly. Then the liver will begin to mobilize its defense around the virus. And then inflammation begins. Most times it targets the liver cells. And once one liver cell is destroyed by a virus of hepatitis, that cell will never come back. It will be replaced with tissue, like a healing scar. Once it is affected, that cell is dead. And for example, if you have a liver cell that has about 3 million cells, once one cell is affected, that cell dies, 2 dies, 3 dies. It goes on until when such a client must have lost about 50% of the liver function, and then it begins to manifest as complications. Next please. Next. We have many types of hepatitis, but of major concern to Federal Ministry of Health are 2. That is the viral hepatitis B and C. Other forms of viral hepatitis are viral hepatitis A, viral hepatitis E, and viral hepatitis D. A, E are not of concern because they are picked from our water, they are picked from our food, and they run a very transient course, a very short course. That course, just like malaria, it just happens and resolves immediately. But for B and C, they are blood-borne, and their transmission follow that same pattern. Go on, please. This is a comparison of the various types of hepatitis. Go on, please. A and E do not run a very prolonged course, but B and C runs very, very prolonged course. D does not exist on its own. It's a parasite. Wherever B is, D will always sit on B to cause more harm. But D on its own cannot exist in the blood system or in the liver if B is not there. Okay, next. Okay, looking at the economic impact of viral hepatitis. The campaign prevents significant cost. The cost URCF is giving Ola, I don't know how to even estimate it. It saves the workers, it saves the individual, and it saves the company far much more than when you are managing just one individual at a hospital management level. So it's like in a ratio of 1 to 9 or 1 to 30 to say, because the cost it would have cost an individual. We have testimonial even among the Olam people that were affected and how much it has cost them to manage their condition. Some of them never even thought they could come out of it. But at the end, because the company became so proactive and did not want to leave the cost to the individual to manage, at the end they came out of it. It has the potential to reduce the productivity of the worker by reason of absenteeism to work, by reason of hospital admission, and by reason of out-of-pocket expenses. Okay? Now, let's pick viral hepatitis B to start with. As of 2013, about 20 million Nigerians already have this virus in their system. And less than 2% of this population knew that they carried this virus. So what that means is, if you have an estimated population of 400 workers, we are expecting about 10 on the minimum, lower level, to 40 persons to carry the virus. And the unfortunate thing is that most of these people don't know that they carry the virus. And as they use the toilet, they use the eatery, they expose others to it. For viral hepatitis B, the highest prevalence has been recorded in Taraba State, where you have about 90% of the population being affected. If you take a sample population of any organization that has, let's say in Nasarawa, that has a staff capacity of about 400 to 500 people, do 90% of that. That is a lot. So when you go to Taraba, you need to be very, very cautious of how you live. Sorry, you're laughing. How you live and how you do things, okay? But that is not to instill fear in anybody. It's just stating a statement of fact. The risk factors is perinatally, mother to child. I don't know online ratio of women to men population, but again, it would be nice. I could see on the platform, most of your managers that are represented here, although I can't see A and KO picture, will need to know that they can transmit this virus if they have it in them to their unborn baby, if nothing is done, like we are doing in OFI. Early childhood too. Children between the age of 2 to 8, they play among themselves, particularly in rural communities. They exchange food, they exchange, they hug, they do so many things together. And in that process, the virus could be transmitted. Unsafe injection, going to the roadside or quack to get medical care. blood transfusion. Before now, most times blood are transfused. There was a case we had, yes, there was a case I had about December, who came to me and was saying, honestly, he did not know how this happened. In fact, he was almost sobbing. And I began to take his history. Then I got to know about 15 years ago he had an accident. And then it ended up in him being transfused about 8 units of blood. I'm not saying it could come from there, but that is a pointer that may be where he got it from. Unprotected sexual contact with an infected person. Again, not using your condom. Condom is promoted heavily in the prevention of viral hepatitis. Again, we said it cannot be spread by contaminated food or water, and cannot be spread usually in the workplace. Well, we just said that, but we have found cases when you profile your staff, some are more predisposed to contacting it if there's even just one person among them that has this. Okay? Next, please. This is how it will look like under a very fine microscope, very powerful microscope. This is how the particles occur. You will see that the virus has filament. It has spherical bodies. That is, if you can just divide the virus into a section, this is what you will find. Next, please. Sometimes the symptoms come like malaria, and it may last for just several weeks. And you may be using anti-malaria treating again and again. This malaria is stubborn, it can't go. It might not be malaria. Go for your test. Know your status for viral hepatitis. In some cases, it comes as a yellowish discoloration of the eyes. Sometimes the urine could be dark. In an extreme cases, there could be fatigue, tiredness, easy tiredness. Nausea could also come with vomiting and abdominal pain, particularly at the region where the liver is located. In severe cases, when complications set in, what we call liver cancer is the end result. And except you have hundreds of millions to undergo liver transplant. Even when the liver transplant is successful, most times such individuals don't last more than few weeks. Okay? About 90% of infants infected during first year of life develop chronic infection. About 90%, particularly the ones that are passed from mother to child. Okay? 30 to 50% of children infected between 1 to 4 years of age develop chronic infection. Okay, next. This is the algorithm for diagnosis. So what you expect in our intervention is that some will be negative. For those that are negative or non-reactive, they will need to benefit 3 doses of vaccines. The first dose at the point of contact when the test was done, the second dose after a month, and the third dose between the 3rd to the 6th month. Okay? For those that are reactive, we'll isolate them. We'll separate them on a different sheet. They cannot benefit from the vaccine, but we have a different package plan for such. Next, please. Next, please. These are, just go back. For those that are reactive, we'll be interested in what serotype, what is the breakdown of the hepatitis. Some have what we call the E envelope. Some have the core antigen or the core antibodies. So some have recent and late antibodies. Next. This is a picture. 15 to 40% of chronic hepatitis B patients may experience disease progression. Those that are infected and run prolonged course without even knowing, they have the infection progressing in them. And some of them may not even know that this progression exists until it ends up with cirrhosis in about 23%, or liver cancer. And if such a person does not have money for liver transplant, most times, unfortunately, they progress to death. Next. Next, please. Okay. For mother to children transmission, the best advice I will give at this point is prevention. Know your status. And OFI has taken the step to allow all our women, our girls that work with the company to know their status. And I use this medium again to say thank you so much. But please don't stop there. As a woman, you have friends outside OLA. You have social group. You belong to various other platforms and meetings. Please propagate the message that it is good to know your viral hepatitis status. If you don't, go for a test. Next. Next. Now, viral hepatitis C. Viral hepatitis C, I will call it a beautiful bride because it is treatable and it is curable. The treatment exists within 4 to 12 weeks, and with an average of about 500 to 600 or 800 now, right? An individual could have himself cure of viral hepatitis C. But hepatitis B is not so. You don't attain cure. Once you are infected, you will be on medication for life, depending on the stage you are. Once you are infected, let me make that clarification. I will repeat that again. For viral hepatitis B, once infected, there is no cure. But you can be on medication for life, on daily medication for life. But for C, once you are infected, after 12 weeks of treatment, there is hope to obtain cure. The virus could no longer be found. And that is why you have this great opportunity. If you don't have now, you undergo these 3 doses of vaccination, and then you'll be protected for the next 30 to 35 years, after which you may require a booster dose of 1 ml. This is how viral hepatitis C looks like when you cut it open. The core is purely proteins, and the back is like an envelope that covers it. Next, please. Next. Next. Again, the transmission follow all the others we have talked about in the case of B. But in addition to this, this has a notorious tendency to be transmitted through people that ingest drug, through sharing of needles. I've had a testimonial in a group of drug users, a male and a female. Whenever they exhaust their drug and the last dose is available, as soon as the male injects himself, the female will need to pierce the skin of the male to take, no matter how small, the quantity of the blood in the male counterpart. So the last dose is most times reserved for the male, but the female will always have a drive to getting it from the male. And most times it's either cutting the male open to suck the blood directly and have a little dose of the drug, or something else. So for C, you could find it among drug users and among men that sleep with men. Okay? Next, please. Next. These are the treatment options for C. Fantastic drugs. Yes, next. Again, what could cause a reduction in the spread of hepatitis is where opportunities for awareness creation like we're doing here, where there's opportunities to educate people early enough, where there's opportunities to encourage people to go for tests, where there's opportunities to do other things that could help propagate the message that viral hepatitis B, viral hepatitis C are silent killers. Next. Now to the proper program of the intervention that has been planned. We have tagged this intervention a diversity and inclusion health project. Why is it diversity? We are not treating OLAM. We have observed that OLAM across all its ramifications has both the white or from the north. It's a mixed population. In fact, it's a typical example of Nigeria. It does not discriminate against the women, does not discriminate against the men. So it is all inclusive. Opportunity is placed on the table for all of the staff without discrimination. The same toilet used by the whites is still the same toilet used by the blacks. The same table where the black eat, the same table, the same conference room. We just saw, even in your other meeting on second floor now, same conference room, they sit around the same table. So we use this opportunity again to thank OLAM for promoting diversity and inclusion programs in his company. Next. So what we have done in this is presenting and indicatively the scheme, the schedule of how the activities of UICF is built around providing this service for not OLAM in Lagos, OLAM OFI in Lagos, but for the consideration for the other states that have been communicated in the mail. Next, please. Can we make it clearer? Thank you so much. Yes, we expect that today is 16. Yes, as at the time this was produced, it was 14th. So we expect that between now and the end of the 25th, today is 16, right? Yes, we must have done the proposed 600, and that falls under the first month, January, Lagos. Okay, spread over its time up to 28. We expect that 28, 29, we must have rounded up the first dose of intervention in Lagos. And then moving on from there towards February, there's consideration for Ondo and Delta State. First week, second week, third week, and fourth week of February. And then from there progressively, moving on to March as the second month. We also have 4 weeks in March, so we expect that in March, Calabar and Ilori could also be done, looking at the first week, second week, third week, and all of this includes also the traveling and departure plan. Yes. Then at the third month, which is April, we expect that Kaduna could be done. We'll do Kaduna with caution because of the security issue and then carefulness. And then worst case, by that end of April, all of the state must have been done. There may be cases from our experience, need for MOPOP, people that were not originally considered, members of families of the personnel that were not thought of as important as benefiting from this. So we have also considered that to be extended up to May for MOPOP purposes. And then at the end of that, our report, just like we have presented for all, everything would have been ready. and then we could have it presented officially to the Olam OFI at the headquarters. Next. So documentation and rollout, that is the timing and the schedule. Next. The end of term project, which contains maintain contact with Olam. It does not mean when we finish now, we are going to forget Olam OFI. We also look for other opportunities that exist for continuous partnership and collaboration. Thank you so very much for your time.
Thank you, sir.